We're live. This is DC to B Revolution. I'm Noah Volz. Today, I'm here with Dr. Shane Steadman. Dr. Shane Steadman owns integrative brain centers in Denver, Colorado, where he specializes in treating people with concussions and brain injuries using functional neurology and functional nutrition. Thanks, Dr. Steadman, for being here.
Yeah, thanks for having me.
Yeah, my pleasure. So I just wanted to jump right in. If somebody wanted to follow in your footsteps and become an expert in a field like functional neurology, is there any original advice that you would give to them?
As far as original advice, when I started, actually, I wanted to go into functional neurology. There's a mentor of mine that my mom worked for that actually is a functional neurologist.
Who's that?
So Michael Pendleton. He's
Okay.
in Albuquerque. So that's somebody that I'd known since I was in high school and had worked on me. So I wanted to follow into his footsteps. And so I went to Parker and started chiropractic. And then I started doing the neurology as soon as I can within my first year of starting school.
And I know you specialize in concussions and traumatic brain injuries. Was that something that Dr. Pendleton was working on you with, or was that something that kind of matured over time?
That's something that's matured over time. Concussions has been a great thing to work on. But what I've kind of found over the years is that, well, I'll back up. I started off just doing neurology. So I wanted to help, people that had vertigo or migraines, ADD, all those different types of neuro disorders. And then the more advanced you get, you find out there's a big field of people that need help in the way of concussions. So, there's sports concussions. There's people that have slip and falls. People have hit their head on an object or a dresser or, a door, knocked them out. There's a lot of people in car accidents. There's a whole slew of people with head injuries. So as I've understood neurology better, I've taken courses to understand concussions and traumatic brain injuries much more than I knew previously.
Got it. So I know for me personally, looking into functional neurology programs, functional medicine programs, they're relatively expensive. And so what would you recommend to a student like me who's already kind of mortgaging their future to pay for school? What's the return on investment? Is it worth it to go into those kind of fields?
Absolutely, it's worth it. I didn't have much money as a student as well, so I was with the Carrick Institute at the time, and that's where I took my courses. And they did a great job of deferring payment, and so I deferred as much as I could. And then when I got out of school, I started paying it back. So that was a great thing about their program. It definitely pays back. There's a lot of people that need the help, and there's not a lot of places to get help. So being a functional neurologist or a chiropractic neurologist out in the field, there's a lot of people that definitely come seeking you out, but you have to get out there as well. So it's not, I think a lot of students that I've met over the years that have come out learning chiropractic neurology or functional neurology, they come out with kind of a notion that the world's going to seek me out and flock to me because I have all this knowledge. And at the end of the day, patients don't really care about the knowledge as much as they're looking for hope. So that's kind of the big thing. So I say that because I've seen too many doctors come out of school, thinking that they can hang up a shingle, say they do neurology, and the world comes seeking them out. You still have to get out there. You got to let the public know that you're available and that you can help them.
Yeah. And so when you first got out of school, did you know that right away, or did it take you some time to kind of build steam? And how did you do that?
It took me a long time to build steam. I didn't know this. I think with most docs that graduate from school, I think the assumption is that you can go out and, put your name up there, put yourself on, a Google platform, build a website, and all of a sudden people just come knocking your door. And that is not the case. You have to have a lot of visibility initially, because visibility will breed credibility, and then credibility would produce profitability. And so I didn't know that. I definitely pounded the pavement. I worked at networking events, and I went to seminars and group events, and everywhere that I could go, I was out there. It seems like it takes about 3 to 5 years. And I think that frustrates a lot of students coming out, but there's so much work that you got to put in on the front end. within the community, because the people just don't trust you, especially when they don't understand what a chiropractic neurologist is or a functional neurologist is. They're kind of skeptical at first. So when you kind of build that trust and you get some testimonials and you get out there in the public, they really start to understand what you do, and that's when you start seeing the referrals come in.
Yeah, one thing that I love about chiropractic neurology, functional neurology, is the clinical reasoning. So once people do start coming in, it seems like you have a really advanced system of diagnosis or of assessment. And so I wonder if you could talk a little bit about how you've developed those clinical skills over time.
Yeah, so one of the things that I love doing is I love the Sherlock Holmes kind of mentality, you know, or if you ever seen House MD, the old TV show, I love that mentality where I like collecting information about a patient and then making a decision on that. So in our office, you know, we have a system where they fill out a really thick intake paperwork. It's got a bunch of questions, a review of systems. It kind of gives me an idea overall how well they're doing and what symptoms they have. Then we do a really thorough history, because as we learn in school, you know, 80% of your diagnosis actually comes from the history. Your testing should confirm or disprove your theories. So we do a really thorough examination in the history, and based on that, well, I'll back up one more thing I'll add. Then we bring in all their old labs. So we have patients bring me their labs. We do an exam. We do a history. They fill out intake paperwork. We have assessment forms. And all that information gives me a ton to look at. And at first, it's kind of daunting because you're like, oh my gosh, there's all this information. But you get faster and faster and faster, and you'll start to see patterns. And so kind of playing Sherlock Holmes with these patients is, you know, trying to figure out what's the cause. You know, and if you can identify that cause, you address the cause, and then you start working your way forward to address the things that have been affected by the cause. So trying to work up these patients is trying to figure out that cause. Sometimes it's easy and sometimes it's hard.
Yeah, when it comes to taking the history, you know, that's such an art in and of itself. How is your ability to get the relevant information from a patient changed over time in terms of the history?
Yeah, I think it starts off with a really good intake paperwork. There's a lot of practitioners I've seen that have intake paperwork that's just basic, you know, supplements, medications, genetic history, you know, some of your big questions. But when you break it down and you look at, you know, GI function, you look at thyroid function, adrenal function, our assessment forms have questions about dopamine, serotonin, basal ganglia, cerebellum, temporal lobe, parietal lobe. So when you look at that assessment form, that really helps to solidify where your questions are going to go. So instead of sitting in a room with a patient and asking all the parietal lobe questions and all the temporal lobe questions, all the basal ganglia questions, all the frontal lobe, and then their signs and symptoms, and then their past history, that's a lot of information. But if you develop a really good intake paperwork, they fill it all out for you. So then your time in the office is spent digging deeper, going to the next layers of questions, not just asking all these surface questions. And it shortens down your time, which is good. And then in my office, I actually have a nutritionist that helps me, and she helps me take the history. So she does a lot of that next layer of work, and then I'll come in and I'll ask a few more questions to tie up the loose ends.
Oh, perfect. And in terms of your assessment forms, is that something that patients can download directly from your website? Or like if somebody wanted to see an example of a really good assessment form, where would you recommend they look?
That's a good question. You know, a lot of people do put their intake paperwork on their website. I don't, and the reason why I don't is I like to look at their handwriting. I like to look to see what they do and how they block things and circle things and their legibility, and that to me is fascinating. So I always have them fill it out by hand. So we don't have it on our website. I know there's a lot of doctors that do. You know, I could do a screenshot, you know, something like our intake paperwork. It's 12 pages though, but you know, I could give like a screenshot of what it kind of looks like. Nothing simple, but nothing elaborate, but you just want it comprehensive, you know. Okay. And usually it takes them a good hour and a half at home to fill it out, but an hour and a half at home that's a lot less time you have to spend in your office, and you can really dive into the issues that matter and not just talking about surface issues.
Yeah, and I imagine it's probably really useful for them as an exercise too, where they can start to see, oh yeah, and make those connections and start to see like, oh, there is definitely something going on. They don't see the pattern, but at least it becomes more apparent that there's something really going on with them.
Yeah, absolutely. At times patients will bring back the intake form and they'll even say, I noticed I circled all the blood sugar, answers. Do I have a blood sugar issue? And you go, well, we'll see. So they almost start kind of identifying those patterns on their own. And so when you do the exam, you do their workup, you can actually match it back to their symptoms and say, this is why you're experiencing these issues. And it really kind of solidifies that that they know that everything is connected.
Yeah, and then you're both kind of on the same page and you can work as a team to really, make some progress in the right direction.
Absolutely.
Yeah. So the last question I have for you is about kind of innovations in the integrative health space. Do you feel like your practice has kind of stayed consistent over time? Or are you implementing a lot of new innovations based on the latest research, and what are those innovations?
We're constantly innovating. I don't think that ever ends. I think if you're not evolving, then you probably stopped researching. So we are constantly innovating. Even docs that have been into my office, sometimes I'll walk into the therapy room and they say, hey, this looks a lot different than last time. It's like, well, we've learned a lot since the last time. I can tell you just my therapy room alone is nowhere even close to what it used to look like when I first opened my practice. And it'll probably change next year because we're going to keep learning more. In the nutrition world, we learn more. Immunology, we learn more. Now we're learning how immunology affects the brain and how the brain affects immunology. So it's a never-ending field. So I think people that are very interested in functional neurology, this is a great field to be in because your brain controls everything, but everything affects the brain. So you have to continuously figure those things out. And I think it keeps us relevant. I think it allows us to talk to other medical professionals. And I think we start to get a lot of great respect within the community, which is cool because we're all talking the same language.
Yeah, completely. And in terms of the research that you do, do you just go to PubMed, or are there ways that you kind of are able to refine and make sure the thing?
So, we look at PubMed. We'll look up a topic. Usually in the office, we'll find a topic and then we'll start doing a lot of research. I have, the privilege to lecture for, like Apex Energetics. So I get to stay current on a lot of the functional medicine aspects. I have, I know Dr. Vijdani, who's in immunology. I go to, Carrick seminars. I go to IAFNR seminars. I try to stay current by going to different seminars and trying to learn as much as I can from everybody because I want to be the best clinician I can be. So you'll get some information in, or you'll learn about something, you see something on Google or Facebook or PubMed or whatever, and then you kind of just explore. And, I think you have to enjoy it. And I think having difficult patients in the office allows that opportunity to get your butt kicked every once in a while and then go figure it out. And then when you figure it out, you learn a lot more. So you don't get your butt kicked anymore until the next patient rolls around, and then they'll kick your butt. And then you have to go do some more research. So I think if you like that kind of style of practice, that's to me, that's what functional neurology, chiropractic neurology is all about.
Got it. That's beautiful. So if people want to reach out to you, learn more about what you're doing, do they go to your website, your Facebook page? What's the best way for people to connect with you if they get really inspired about what you're doing?
Yeah, absolutely. I think, if they want to talk to me directly, especially, students and other docs, my Facebook page is a great place to reach out. They can also go to my website and learn more. I got 2 different websites. I have Integrated Brain Centers, which is integratedbraincenters.com. My functional medicine website is also up, and people that are interested in that world or combining the 2 worlds can look at integratedhealthdenver.com. But those are 2 ways of getting a hold of me. Facebook's always a great way because, we know people in the neurology groups and the clinical nutrition groups and the functional medicine groups. So there's a lot of kind of those subgroups on Facebook that are great to reach out, and connect with each other. So those ways are always great. I'm always happy to talk with people. And, we also do, we provide the opportunity that people want to either shadow us or do an internship. We've done a lot of those things over the years. So those are great ways to connect or learn more as well.
Awesome. Thank you so much for that. So this has been a broadcast of DC to Be Revolution. I'm Noah Volz. I'm thinking big to live large. If you like this interview, let us know, make some comments, subscribe to the channel. And thank you once again, Dr. Shane Steadman, for being with me today.
Yeah, thanks for having me.